This is Northwell Health's presentation on the Accu Chek Inform 2 and the Coordinating Hypoglycemia Protocol. By the end of this presentation, the learner will be able to describe the hypoglycemia protocol, identify the components of the meter, state the process for performing quality control tests and patient tests, identify the acceptable specimens and potentially unacceptable patients for fingerstick testing, state what the high and low messages mean on the meter and what the highest and lowest reportable values are. State the method for cleaning the meter along with the frequency and the appropriate storage of the meter. Hypoglycemia is defined as a blood sugar less than 70 in the adult patient and less than 60 in a pregnant patient. Signs and symptoms that either patient may present include shaking, sweatiness, headache, hunger, anxiety, tachycardia, dizziness, impaired vision, or tingling around the mouth and lips. There is a variety of oral treatments that may be given to a responsive adult patient experiencing hypoglycemia. The patient may receive 15 grams of fast-acting carbohydrates in the form of a glucose tablet or gel, regular soda, or fruit juice. It should be noted that orange juice should not be given to patients with renal disease. The expected response is a 30 to 45 milligram increase in the patient's blood glucose. On this slide, you will see the algorithm for an adult non-pregnant patient in hypoglycemia. It starts at the top with a blood sugar of less than 70. You must then recheck the blood sugar to confirm your result. If the patient is unresponsive, you would call a rapid response. If they are responsive, are they able to eat or swallow, or are they MPO or uncooperative? Based on these selections, you will follow the arrows down to give the patient the appropriate treatment. This slide contains the hypoglycemia protocol for a pregnant patient. Similar to the adult patient, you begin with a blood sugar at the top. If the blood sugar is less than 60 in the pregnant patient, you must recheck to confirm your result. If the patient is unresponsive, you would call a rapid response. If the patient is responsive and able to eat, you would give a PO treatment. If the patient is responsive but MPO, you would follow the orders as dictated on the protocol. We will now review the Accu Chek Inform 2 glucometer. This portion of the presentation is to provide an education on the standard of care regarding the use of the Accu Chek Inform 2 glucometer. Here we will review the quality controls, patient testing, and comment codes. This module is not intended to be all-inclusive, but rather provides an overview of salient points related to the Accu Chek Inform 2. Initial training of the Inform 2 glucometer includes a competency, an education module, and a successful passing score on the associated exam before you can perform a fingerstick on a patient. 4 to 8 months later, a semi-annual competency is performed, and from that point moving forward, an annual competency is required. At all of the sites or ambulatory setting, a barcode may be given to you, whether it's embedded in your badge or you'll be given a barcoded label that will affix to the front of your badge. Contact your point of care testing coordinator if ever your operator ID is returned as denied or invalid. It is very important to never use a barcode other than your own. We will now begin to review the system components of the glucometer. On the slide, you will see the front of the Accu Chek Inform 2. The test strip is found at the top of the meter as indicated by number 1. Here is where the test strips will be inserted for each quality control and patient test. On the front of the meter is a large alphanumeric touchscreen. 3 is showing the power button, which is found underneath the touchscreen. This is a wireless glucometer with a rechargeable battery. While you have it off of the docking station, you should keep a close eye on the battery life. You can see it as indicated by the red arrow on the bottom right hand of the screen. Moving to the back of the meter, starting at the top, you will see the barcode scanner as indicated by number 4. This is what you will use to scan your own ID badge for the operator ID and scan your patient's bracelet to enter the patient ID. There is a battery pack on the back of the meter, which is charged by number 8. the two round metal buttons or the charging contacts. These come into contact with the base and will allow the battery to be recharged in between usage. Number 10 is the cover for the RF card. The RF card is what allows the meter to speak to the wireless network of your site. Once you have finished your Accu checks and the meter has been properly cleaned, you should return it to the base unit or docking station. Number 17 is indicating the status LED. These lights will let you know the status of the docking station. When it is first plugged in, it will light up red. This means the power supply is connected. The light will then turn green to let you know that it's ready to receive and charge your glucometer. The Accu Inform 2 is a wireless device. It allows for your Accu results to be transferred to your EMR or electronic medical record. It is done at 3 different intervals. As soon as a finger stick is completed, every 10 minutes when the meter is idle even if the meter is off, and after docking, and then every 10 minutes thereafter. You can always perform a data transfer automatically by putting the meter into the base unit. Always remember to dock your meter for charging when it is not in use. For those of you working in an ambulatory setting, the wireless transfer is not available and you will need to enter the results in the medical record manually. The Accu test strips should be stored in its original container. The strips are very sensitive to humidity, so the container must remain closed at all times. Improperly stored test strips can produce inaccurate results and should be discarded immediately. Test strips are able to be used until the expiration date printed on the vial. You must label the vial with the date of opening. After removing the test strip from the vial, remember to close the vial immediately and use the strip immediately. There are 2 quality control levels. Level 2 is high, level 1 is low. These vials expire 3 months from the date of opening or the manufacturer's expiration date, whichever comes first. You must document the open date and the expiration date on each vial once opened, ensuring that the label does not cover the expiration date or the barcode on each vial. These reagents are stored at room temperature. Once the open date or expiration date has passed, you must discard them. We perform quality controls daily. This is to ensure that the device is properly working and that the operator's technique is correct. 1 high level and 1 low level must be performed on each machine daily and any time a new vial of strips is opened. If you need to take a patient's glucose urgently and the display message of QC due immediately appears, you must immediately run both controls before you're able to perform the patient testing. The device will only allow for patient testing if the appropriate quality control checks are performed and have both successfully passed.
Procedure for performing quality control testing on Accu Inform 2 meter. States that 2 quality control checks, 1 high and 1 low, must be performed on each machine once daily and with each new vial of strips. Before performing quality control checks, visually compares lot numbers on high and low solution bottles to ensure that they are the same. Inspects bottles for both open and expiration dates, verbalizing that control solutions are discarded at the earlier date of imprinted expiration date or 3 months later from the date of opening. Ensures label does not cover expiration date or barcode. Performs hand hygiene and dons non-sterile gloves. Turns on glucometer, presses scan button, and scans operator ID, badge, or barcode. From main menu, touches control test. Selects level of control to test, high or low, and scans the barcode on the control vial for the desired level. Check strip vial open date written on the vial and expiration date. Scan strip lot. When prompted, removes a test strip from the vial and immediately recaps the vial. Immediately inserts test strip into meter in direction of arrows with Accu Chek lettering facing upward and waits for flashing drop. Applies a drop of glucose solution to the front edge of the test strip when prompted and recaps solution bottle. Removes the test strip and disposes it in the approved waste container. Reviews the result displayed in the meter screen. Touches the comment button and enters appropriate comment. For example, pass QC would be comments accepted cleaned meter. Failed QC comments will repeat test or wrong control level. Touches the check button to confirm comments and touches check button again to save results and return to the main menu screen. Repeat the same process for level 2. Removes gloves and performs hand hygiene. States and demonstrates procedure for cleaning and disinfecting meter after each patient use. Dons clean gloves, wipes meter with manufacturer-approved disinfectant,
Before performing a finger stick, you must ensure that the patient's hands and fingers are clean and completely dry. Any residue from food, hand lotion, sanitizers, or excess moisture can cause inaccurate results. Fingertip or capillary samples should not be tested on patients who are exhibiting decreased peripheral blood flow. These may be patients who are in diabetic ketoacidosis, a hyperglycemic state, hypotension, shock, or have peripheral vascular disease. If you have any of these patients, you should obtain a venous or arterial blood sample. The Accu Inform 2 can accept capillary, venous, or arterial specimens, and for the neonatal population, a heel stick. There are patients who may not be candidates for fingerstick blood glucose due to the potential for inaccurate results. These patients may have severe edema, so the fluid can dilute the blood, severe constriction, a hematocrit of less than 10 or greater than 65. When selecting a digit for a finger stick, avoid sticking the thumb or pinky finger. You need to puncture the outer aspect of the finger pad no lower than the nail bed, as indicated by the picture. For neonatal patients, utilizing a heel stick, puncture the lateral or medial plantar surface of the infant's heel.
Performing a patient test utilizing Accu Inform 2 meter. Gather supplies, clean barrier, for example, chucks, 2 pieces of paper towel, or a plastic bag, alcohol pads, lancet, gauze, adhesive bandage, and manufacturer disinfectant wipe, test strip vial, and glucometer. Performs hand hygiene. Put on gloves and conforms to standard precautions throughout the procedure. Creates a clean work surface and places the meter and supplies on a clean barrier closest to the patient, with the exception of the strip vial, which is placed further away from the patient. Check strip lot vial for expiration date. Removes one strip from vial and immediately recaps the vial. Place strip closest to the patient on the barrier. Place a strip vial with the barcode visible furthest away from the patient on the barrier. Do not touch the strip vial again until leaving the patient's room. Identifies the patient using 2 identifiers, as per Northwell policy. Informs patient he or she will be performing a finger stick to check blood sugar level.
Mrs. Katz, I'm going to be doing a finger stick.
Sure, okay.
From the main menu, touches patient test. Scans patient's Aztec barcode on the patient wristband, or enters patient account number or first and last name in ambulatory practices. Presses the green check icon button if manually entered. Confirms information on the meter display and validates that the correct patient was scanned by confirming the patient's ID, name, and date of birth appearing in the patient confirmation window and pressing green check icon button. If the wrong patient was scanned or entered, taps on the red X icon and repeats the identification process and scanning. presses the scan button and scans or verifies the strip lot number without touching the strip vial when prompted. Inserts the test strip when prompted into the meter in the direction of the arrows with Accu Chek lettering facing upward. Slides the test strip into the test strip port as far as it can go in the direction indicated by the arrows. The meter will beep. Once the meter has detected the strip, the user is prompted to apply the blood sample when a flashing drop appears on the screen. Demonstrates proper procedure for site selection and use of auto-disabling single-use capillary lancet. Wipes side of finger or heel in pediatrics with alcohol and allows to dry. Lances side of finger or lateral or medial plantar surface of the heel.
Mrs. Katz, you're gonna just feel a stick now.
Sure.
Wipes the first drop of blood away with dry gauze. Uses second drop to dose the strip. Holds meter in a horizontal position. Applies the drop of the patient blood to the front edge of the strip. Do not apply sample to the top of the strip. Places glucometer and use supplies, gauze and alcohol, on the barrier closest to the patient or immediately disposes in an approved waste receptacle. Disposes of lancet in Sharp's biohazard waste container. When the test is complete and the results are available, the meter will beep again. Review the results displayed on the meter screen. If the test must be repeated, removes gloves and performs hand hygiene. Dons clean gloves and removes a test strip from the strip vial, closes cap and places on the clean side of the barrier or outside of the room in a scannable position. Repeats the test, places the meter on the barrier closest to the patient. Comment codes are required. On the patient test screen, touches the comment icon button. Selects up to 3 pre-configured comments from the display list and enters an appropriate comment. For example, accepted clean meter, notified MD or RN, will repeat test, etc. Touches the check button to confirm that the comment has been entered and touches the check button again to save results and return to the main menu screen. Removes the test strip from the device, states or demonstrates procedure to discard test strip in an approved waste container. Presses the power off button to turn the meter off. Remove soiled gloves and discard. Perform hand hygiene. Don clean gloves. Use approved manufacturer disinfectant wipe. Remember, for patients on precautions for C. difficile or Candida auris Clorox germicidal wipes must be used. For all wipes, squeeze off excess liquid. Wipes should be moist, not saturated with solution. Pick up the glucometer. Ensure the meter is turned upside down with the strip port facing downward. Gently wipe all areas of the outside of the meter 3 times horizontally and 3 times vertically. And carefully wipe around the test strip port area. Ensure you do not oversaturate the device. Liquid does not enter the strip port and all areas are wiped. Place used disinfectant wipe on barrier side closest to the patient with the used supplies. Place glucometer on the barrier side furthest away from the patient. Only test strips and clean glucometer should be on this barrier side. While allowing the glucometer to dry completely, gather items used from barrier side closest to the patient. Dispose of lancet in sharps container. Dispose of remaining used items in approved waste container. Remove the gloves and perform hand hygiene. Pick up dried glucometer and test strips with clean hands. Remove barrier by picking it up from the center clean side and disposing of the barrier in an approved waste container before exiting the room.
Once your finger stick is complete, the device must be cleaned and disinfected between patients. For this, we use our Sanicloths or bleach wipes. For all wipes, you should squeeze off any excess liquid before wiping the meter. We want the wipes to be moist, but not saturated with solution. Before we begin, you want to turn the meter upside down with the strip port facing downwards, so that the solution does not pool inside the meter. You need to gently wipe all areas of the meter 3 times horizontally, followed by 3 times vertically. You may disinfect the docking station or base as needed. Again, avoid wetting the connector or the silver buttons on the base unit. This may prevent the battery from being charged. As mentioned previously, there are 2 types of disinfectant wipes we can use when cleaning the glucometer. The first being the Super Sanicloth wipes. These are in the purple top containers. You may also have individually wrapped wipes. This needs a 2-minute contact time in order for the disinfectant effect to occur. We also have Clorox germicidal wipes. These have a 3-minute contact time. You may see it in a container or individually wrapped. Remember, this is what we need to use for patients who are on contact precautions for C. diff or Candida auris. The normal fasting glucose range for a patient on the Inform 2 is 70 to 99. A test result of less than 10 will only be displayed as low. A test result of greater than 600 will only be displayed as high. On the slide, you will see the critical glucose patient results. For an adult, it's less than 45 or more than 450. For neonates, it's less than 45 or higher than 300. The Inform 2 requires an entry of a comment for each critical test result. There are multiple predefined comments, or you can free text a comment. If the displayed meter result is not consistent with the patient's symptoms, you will need to repeat the blood glucose and notify the RN or MD immediately. The RN will then obtain a stat lab glucose order. In the Accu in Form 2, you should enter comments such as venous sample sent to lab or stat lab to verify, and then as applicable, either RN or MD notified, read back. For results that fall under the definition of a hypoglycemic blood glucose, this being under 70, you will need to repeat the blood glucose. The RN should provide oral treatments in patients that are responsive. These patients should be able to safely eat, swallow food, and/or liquids. The RN will then obtain an order from a provider as appropriate for D50, IV push, stat, glucagon, or IV fluid. You will then recheck the blood glucose in 15 minutes. If at any point the patient becomes unresponsive, you should call a rapid response. You need to document the hypoglycemic episode and all interventions in the patient's medical record. All critical values must be repeated, confirmed, and reported. A comment should also be placed in the Accu in Form 2. An RN should report the glucose value to a licensed independent practitioner. An LPN can report the glucose value to a nurse or an LIP. Any member of the patient support team, if it's included in their scope of practice and they are performing a finger stick, can report the glucose to an RN or a licensed independent practitioner. Comments must be placed in the Accu in Form 2 for all values, including critical values. These critical values are again repeated, confirmed, and reported. Any critical result must be communicated to the physician or the advanced care practitioner and addressed by the registered nurse. Additionally, the nurse should document a critical value note, which would include who was notified and what actions are taken. Also, they must include documentation of a provider contact note for this event. This slide is displaying what you will see in Sunrise when the blood glucose is transmitted through the hospital's Wi-Fi. You'll see that indicated by the blue arrow, a point of care testing or POCT result is 65. If the system does go down during downtime, a manual entry is required in the vital signs flow sheet, which is shown by the screenshot at the bottom. The Accu in Form 2 has a review result option. The operator can access any of the following information: patient ID, glucose control or sample ID, the test result, the lot numbers of the reagents used for control, the date and time of the test, and any comments entered at the time the test was performed. This function may be accessed from the main screen. You will see three options: patient test, control test, and finally review results. Tap on Review Results. All stored results are displayed in a list. You may hit the up arrow or down arrow to scroll the list. When you touch the patient from the full list view, you'll be asked to enter the patient ID manually or via the barcode scanner. You will now be able to see only the results for that selected patient. If you encounter that the meter display does not work or the meter does not power on, wait 10 seconds and press and hold the power button again. Then place the meter back in the base or the dock and confirm that the meter is charging. Check the battery icon. The screenshot below shows the various icons that you may see. If the meter is red, the battery is empty and you will need to dock the meter. Once it's docked, you will see the battery icon with a lightning bolt. This is showing that the meter is being charged. If this does not fix the problem and you work in the hospital, you will need to return your meter to the lab. If you are in an outpatient ambulatory setting, you will need to call the core lab for further help. If the electronic medical record, or EMR, is experiencing downtime, you will need to manually enter any results. Please observe all site-specific resulting procedures in order to enter the results in the patient's medical chart during the downtime. When the EMR does go back online, the glucose results will be automatically transmitted from the meter into the Results tab.